Hi, my name is Joy Haylock, and this is a video of the sheep heart dissection. First, we'll start off reviewing the outermost layer of the heart, which is the visceral pericardium, also known as the epicardium. That can be viewed right here. To identify the next structure would be the apex of the heart. This is the most protruding point at the very base of the heart. That's the apex. And then we'll go on to view the right atrium, which is right here, this area here, and the left atria, which is right here. Okay, the right atria is where deoxygenated blood flows into. And the left atria is where oxygenated blood flows into from the pulmonary veins. Okay, and the right auricle is right up here, the kind of flappage that covers over that space, and the left auricle be right here. The other actually. Yeah, right here. Okay. And the right and left ventricles, I think we reviewed, would be inferior to the atria. So right ventricle here, left ventricle here. The intraventricular sulcus is this deep groove that we see here. It carries within it, at least underneath this fatty skin, coronary arteries. The pulmonary trunk is right here. Oh, pulmonary trunk is right here. And the pulmonary trunk carries blood that's going from the right ventricles into the pulmonary trunk, carrying over to the lungs, where it can be oxygenated and then brought back into the heart. The aorta, there we go. Aorta is right here. And blood from the aorta goes directly into, I'm sorry, the aorta is a little cut off. Actually, the aorta is right here. And blood from the aorta goes directly into the left atria. The ascending aorta is right here. And the aortic arch contains three major vessels: the brachiocephalic, which is the first one, the first opening. Sorry, mine is not in the best shape, so we'll look at it from the posterior side so you can see it a little better. The brachiocephalic, the left common carotid, and the left subclavian. So of those, unfortunately, they're not well observed on my particular specimen, so sorry about that. The superior vena cava can be best appreciated from the posterior side, right here. This opening here where you see it darkening. The inferior vena cava is actually right alongside it. The coronary sinus right along this backside here. And it actually carries with it, or continues from it, coronary arteries that carry around down the heart. The coronary sinus carries with it oxygenated blood that goes directly into the myocardium of the heart to provide the heart muscle itself, the deepest heart muscle itself, with oxygenated blood, and to also remove fluids from tissues or waste from tissues of the heart muscle itself. As we look at the internal structures, we have again the right atria and the right ventricle, left atria and left ventricle. We'll look a little more closely so we can view the pectinate of the inner wall right along here. I'm sorry, actually that would be on the right side. It's not showing right along here. And the myocardium is again this deep tissue here, which is the actual innermost muscular tissue of the heart itself, the myocardium. Okay. And as you can see, the myocardium of the left side of the heart is significantly thicker, specifically 3 times thicker than the right side. The reason for that is because of the left side is responsible for pushing out blood into the entire body that has been oxygenated, whereas the right side is receiving blood without oxygen, and it's using its pressure to push that directly into the pulmonary artery and then into both of the lungs. So because this blood goes from a shorter distance from the right ventricles to the pulmonary trunk and into the lungs, the size and pressure that would be needed on the left side of the heart, on the right side of the heart, is less than that of the left side of the heart. But yeah, there's a very significant difference between the right and left side, and it has to do with the amounts of pressure that those sides are responsible for delivering blood flow with. And let's see. The next structure we'll go over is the bicuspid valve. Bicuspid valve is right here. You can see it's a little flap space, and that's on the bicuspid valve, also known as the mitral valve. Okay, and then as we go over to the right side, we have, let's see, our valve's a little higher. Actually, the valve was cut, so I'm going to turn it a little bit. But on the right side, we have the valve right here. And the valve for the right side is known as the tricuspid valve. And then right below that would be the chordae tendineae. Those are the strings that are connecting to the valve itself. And at the base of those cords are the papillary muscles. And within the pulmonary valve, within the pulmonary artery is the semilunar valve. It's about midway between the pulmonary artery, and it again prevents backflow of blood back into the right ventricle from the pulmonary artery. And then in the aortic contains the same structure. So the aortic artery contains the same structure for a semilunar valve, which prevents blood flow from the aorta back into the left ventricle. And that concludes our dissection of the heart.